my name is Caida Andrew, and I had gonorrhea. So, the epidemiology triad, the agent is the bacteria Neisseria gonorrhea. The host is any person engaging in unprotected sexual intercourse, and the environment is warm, moist areas of the body, including the urethra, eyes, throat, anus, vagina, and the reproductive tract in females. So, there was something that was interesting to me, which was why gonorrhea is called the clap. There are three theories as to why gonorrhea could be referred to as the clap. The first one is from the Old French word for brothel called clapier. So this is named after rabbits, and considering that prostitutes have sex like rabbits, that's where the name originated from, and that brothels were one of the main places STDs arose from. And the second theory is from a horrible treatment that men use to simultaneously clap their penis and try to get rid of any of the pus or discharge. And then the third was from the English word clappin', which means to beat or throb, and that's from the symptoms in men where you can have burning, painful urination, and the throbbing sensation in the penis due to like the inflammation in the infection. So factors impacting the life cycle. Well, basically, gonorrhea can multiply and grow easily in warm environments on the body, and they attach to the mucosal membranes that usually follow intercourse. They can spread into the uterus and the fallopian tubes, which will make them result in pelvic inflammatory disease, and that's way worse because that can lead to infertility. And also, the main way that you could like break the cycle is by using condoms, practicing abstinence, or having sex with one partner in a monogamous relationships. Also, antibiotics can break the life cycle, but other than that, it pretty much stays in those warm, moist environments of the infected people. So the incubation period in males is usually 2 to 7 days after infection, but it can take longer. It can take as long as 30 days. In females, though, they're a lot more mild, so they kind of show up as like a urinary tract infection or a yeast infection. But if 30% of women did show symptoms in like about 14 days, and that usually included like pelvic pain or vaginal discharge. But oftentimes there are just no symptoms at all for gonorrhea. 10 to 15% of men and 80% of infected women may show no signs at all. So the main route of transmission is through sexual intercourse, obviously, but it's spread by having vaginal, anal, or oral sex with someone who is infected. The only other way other than like actual sexual intercourse is if maybe you like have touched the disease and then touched yourself, or if you're a pregnant woman, you can give the infection to your baby during childbirth, usually through their eyes. And that's why they usually get eye drops right after birth. So there are populations impacted, and I saw that the racial population, African Americans have the highest rate, and they're 9.6 times higher than the white races to get this disease. But age-wise, it's more adolescents and young adults, so 15 to 24 in women most likely, and then 20 to 29 in men. Ages 20 to 29, but in 2015 they said that men were higher than females. They increased 18.3% of men, and women only increased 6.3%. So for the geographical distribution, I looked in all the 4 regions of the United States, and the most increased was in the West, having a 92.2%. And every year before 2015, the South has prevailed, being the highest rates. But in the South, the highest rate is in Louisiana, and that is 221.1 per 100,000 population. So the first signs in humans in my nursing assessment. So if you do have symptoms, the first notable symptom in men is a painful or burning urination, and the throbbing or discharge from the from the penis. But you can also have redness and swelling, the frequency, and then there's a persistent sore throat. In women, they usually don't have symptoms, but if they do, it's the burning or painful while urinating, the discharge, and sharp lower abdomen pain. So the nurse would begin the assessment with like the interview of the full medical history, everything they've taken, birth control for women, menstrual cycles, and their sexual history, so sexual intercourse and contact, and then you would want to try to do their pain level, their pain scale, input and output, their frequency and urgency of urination, if they've had any changes in that. You want to assess their genital area for any discharge, redness, tenderness, or swelling. And you can assess physical pain in the abdomens for women. You want to assess the throat for any persistent pain, and their vital signs, including the temperature, because women can have a fever, and that can be one of their signs. So gonorrhea is a reportable disease on the Mississippi State Department of Health, having 5,629 cases in Mississippi in the year of 2014, and that's the last year I could get for Mississippi and the gonorrhea treatment or gonorrhea rates. So medication you use, gonorrhea can be cured, but it has to have the right treatment, and the CDC recommends dual therapy, so taking two medications at once. So a single dose of 250 milligrams intramuscular ceftriaxone, probably said that so wrong, and 1 g of oral azithromycin should be taken daily, and you need to take it all the way through. But if your signs and symptoms continue for more than a few days after your treatment, then you need to go back. Precautions needed in the home setting would be, the number one precaution is abstinence, but if you are sexually active, use condoms. That's the main precaution. But in the healthcare setting, if you are dealing with patients who are infected with gonorrhea, you want to make sure you use proper hand hygiene and use gloves anytime you're handling the bodily fluids, or if you're collecting a specimen for testing, then you need to make sure you're protecting yourself. So primary prevention is obviously education in the schools, and just education in general about abstinence and safe sex, and how gonorrhea can have no symptoms at all. Secondary prevention would be making sure to get tested from your healthcare provider and doing all the things you need. And then tertiary prevention is completing your entire dose of recommended medication. Some interventions that can be used are education, handing out condoms, giving people more free condoms, having a more cost-efficient screening program. So maybe if it wasn't expensive and it was easy to get screening available for high school and college students, maybe at their school. So high school students should be screened every year at their high school. And then the community outreach, positive social media on screenings and prevention, and to show how important it is to get tested. There are a lot of PSA campaigns on gonorrhea. There is a Get Yourself Tested campaign, the Great American Condom campaign, Gonorrhea Awareness campaign, and the Gonorrhea PSA NWACC. So my public health alert, I came up with 2. Are you sexually active? Are you using a condom? ? Know your risk of developing gonorrhea, and see cdc.gov/std/gonorrhea. And have you ever been tested for an STD? Know your risk of having asymptomatic gonorrhea. And then see that same website. And then I have my reference pages, and that's it.